I do not believe that healthcare will be able to sustain itself at the rate it's going by treating people this way. It's not going to work. We have people actually dying from it. I mean, that's not my opinion, that's a fact. So if we actually start to treat people in a functional manner, where we're breaking it down granularly, well, we got to get the vertebrae to move in its proper direction. That's chiropractic adjustment. Well, we got to get the musculoskeletal system balanced so that the posture restores to normal. That's a physical therapy or rehab component. Well, we got to break up adhesions in the muscles that are developing these adhesions because they have trigger points because of the postural changes. That's a medical therapy. And working together, all these things can be combined to get a very non-drug approach. When we're treating things like the trigger point injections, we're not using cortisone because cortisone is steroid hormone, and when you put a steroid hormone in your body, it throws all the other hormones out of balance, which is why too many steroid injections can cause you to have diabetes. It can cause depression. It can cause memory loss. People don't realize how dangerous these things are. So I just read an article from the British Medical Journal saying that there was a significant increase in the case of acute coronary syndrome, which is a heart attack, for people who get steroid injections. You know, you look at it and go, well, all those weightlifters and powerlifters and the wrestlers that were doing steroids, a lot of them died of heart attacks. Well, that would make sense then. So why are we using these dangerous drugs? We don't use those in AMI. What we're doing is very conservative things. We're doing trigger point injections with lidocaine and very non-invasive drugs like Tramiel, very safe drugs, been on the market for 100 years. Lidocaine is 99% saline solution. So we're using the mechanical agent, not the chemical agent, to break down the adhesions, meaning that we're using the fluid to break the adhesions. We're also using regenerative medicine, PRP, things like that can help people get to levels of improvement that we haven't seen before we started using those things. So it's combining these different treatments together in a toolbox, led by a medical team that has a chiropractor on it. We're not prescribing family practice meds or any of those other meds. There's plenty of places they can go for that. What we're dealing with is how do we functionally correct this condition of a back or neck problem, and that starts to bring in hip problems and knee problems and ankle problems and shoulder problems. And how do we treat them in a way that we can actually get these patients corrected so their symptoms go away and stay away? So that's the purpose of why we do an integrated model. We are trying to actually introduce an idea that's been around for a long time. I didn't invent all these things, I just kind of put them together. But it helps people get well in a way that their problems are as close to being corrected as you'll ever get. It's not just covering up the problem, it's actually improving the condition of the body so the body can function without pain. And then therefore it doesn't have to have pain medication. So if you're into an idea of helping people with chronic pain, helping people with chronic degenerative arthritis, that's what we focus on. We would love to hear from you. This is what we do. And we think we need more clinics like this. At AMI, we recognize the job of the doctor is to figure out why is the patient having symptoms, what is not working, get that working so the symptoms go away and stay away.